Hello, Dr. Kristina Lovato. Thank you so much for accepting this interview and, providing information about yourself and about your work to our members. Thank you so much for
Thanks
being
for having
here.
me.
Yeah, thank you. So I would like to start with my first question, and it would be great if you can tell us about your current work at the Center on Migration and Child Welfare Initiative.
Sure. First of all, thank you for having me. It's an honor to be with you all. Um, I'll start by saying I'm an assistant professor in the School of Social Welfare at UC Berkeley. I also direct the Center on Immigration and Child Welfare, which is a national peer-led organization. It's actually been around for a couple decades now. As the director of the Center on Immigration and Child Welfare, located at UC Berkeley School of Social Welfare, our aim is to ensure that children who are of immigrant families, mixed status or otherwise, have the best access to services and programs, particularly if they are at risk or are entering the public child welfare system due to issues around immigration enforcement. As we know, the child welfare system at large was not designed specifically to respond to the specific needs of immigrant children and families, but due to increased immigration enforcement, um, there has been, an increase of children who are entering the system because of many factors related to parents being detained and deported, left without caregivers, and unfortunately having to enter the public child welfare system. So, the CICW, Center on Immigration and Child Welfare, again, is a national peer-led organization, and we have really three aims. We work to produce timely research that is translatable, that is available, to support and better understand the needs of mixed status families who are experiencing a forced migration. The research is always translatable. We produce research that is accessible to the community, to public child welfare workers, to service providers, legal service providers, and those who really need that tangible information in a timely manner. We also provide support for practitioners. So we provide actually a quarterly phone call, or Zoom rather, and this quarterly call offers an opportunity for practitioners across the nation. Generally, they are public child welfare workers or those who work in allied fields, maybe legal services or social workers who are interfacing with public child welfare. And this particular Zoom call, which happens quarterly, we bring in guest speakers. So those who work in policy here in Washington, D.C. and otherwise, and who have timely updates on what's happening with regards to immigration enforcement. So that provides an opportunity for our practitioners to understand of the moment what's happening. We also provide guest speakers who can speak to other issues, amazing best practice services and programs that are making a positive effect or that are enhancing the support for immigrant children and families. In addition to that, we provide technical assistance. So for child welfare agencies or other allied partnering agencies in the community, we also provide trainings to support practitioners who are, again, needing services or ideas, best practices, who are already doing great things but want a little bit more enhancement on what they can do better. And all of that is evidence informed. So we provide, again, research, practice, and technical assistance across the country to those who are at the intersections of immigration enforcement and child welfare.
It's such important work. You're not only supporting the people, the communities who are in need, but also you're supporting the practitioners themselves as well.
That is true. I'll also add that we have a research work group. So for scholars, whether it's emerging PhD scholars or we have MSW interns at times, and we also have faculty members across the nation who are studying the intersections of immigration, child welfare, and allied fields around that. We also offer a research work group. So for those who are studying these issues, we get together quarterly, we learn about each other's work, we support each other's work, we present at conferences, and publish together. And so that's another way to disseminate this information and knowledge. We also have one other arm that I wanted to mention, which is the CICW Legal Network. So there are many legal service providers who are also working at the intersections of immigration enforcement, child welfare practice, and they got together and said, we'd love to join forces with CICW. Many of them work for the American Bar Association, for Immigrant Legal Resource Center, and others, and together they meet regularly as well and provide us with timely information as well from that policy kind of, standpoint. So we are multidimensional in many ways.
So it's like multidimensional, and it
Mhm.
also sounds like you're being a bridge like between communities, practitioners, and also researchers.
That's true.
So my next question is really related with that. So you're doing so much like important work. So what drives your passion for this work?
That's a great question. I'll start by saying that I myself was a bilingual social worker working in the Bay Area right out of my master's program for many years. I was a Title IV-E or child welfare scholar, and so I went right into working in a bilingual Spanish-speaking unit of a child protection agency. And in that work, I saw over and over again families who experienced forced migration due to many different factors. And were dealing with a really difficult time, sometimes coming back together as a family unit, but having to deal with issues around trauma, issues of economic insecurity, discrimination, issues of acculturation challenges, and resettling into new communities. And so this passion really drove my interest in, as I noticed over and over again, systemic inequities, barriers to accessing services. As I noticed this over and over again, this phenomenon, I really became driven and passionate about understanding it at a very deep level and working to address it and advocate for these families in multiple ways. And so, as my time as a child welfare worker ran its course, I moved into doing some mental health work with these families as well, in school based and mental health settings, and realized that I might have a different kind of impact as an academic, as a scholar, who could produce original research, inform policy and practice, and create different opportunities to disseminate work at a larger level, at the policy level. And so I would say my work as a practitioner for many years at the bachelor's and master's level really did inform my experiences, allowed me to see firsthand what families were going through, many of whom were Latinx, and were experiencing issues around, again, trauma, resettlement, discrimination, ambivalent context of reception in new communities. And that really propelled my interest and passion to produce research, to advocate for policies and program changes, and also to, I think, inspire emerging social work practitioners and doctoral students at the levels that they are working at. So I love being able to teach classes in which I can inform students about the issues that immigrant communities are navigating. Many of the students that I'm working with are, in practicum settings in which they are placed at legal service agencies or in public child welfare agencies, school-based mental health. And so to be able to think with them at a larger level about these issues and to inspire perhaps them who are doing the direct service now is really, really exciting and motivating, and I think has a profound impact. So I love the work.
Thank you so much for sharing that. It is truly inspiring for students like I am, and for like maybe practitioners as well
Yes.
to hear about your story. So our next question is, considering current research and literature on forced migration, what gaps do you believe require further exploration?
Yes, excellent question. I'll start by sharing a little bit about the work that I've been doing recently, and then I'll get to some of the gaps. So within the last couple of years, I would say my work has centered, actually for many years, at least a decade, on understanding the impact of deportation-related family separations. Upon doing that qualitative work and understanding the findings that are out there in the literature around, that families and adolescents in particular navigate trauma, the experience of ambiguous loss, the experience of challenges reacclimating to school once a parent has been detained or deported. All of that has propelled my work a bit further into the area of looking at a couple of different issues. One is the experience of unaccompanied minors who migrate to the US on their own without a caregiver, a parent, particularly in the last decade, and are coming from really the northern triangle of Central America, Honduras, Guatemala, and El Salvador. And within their experience, I've been interested in looking at their mental health experiences upon resettling the United States. So I, with support from Casey Family Programs and the Institute for Research on Poverty at the University of Wisconsin-Madison, I was able to examine qualitatively the experiences of 87 um, participants. 20 were unaccompanied youth around the transitional age youth population age, or 18 to 24-year-olds who've come here and who are navigating an experience of basically being in legal limbo. They are transitioning to an adulthood, which is already a precarious time for all of us, and then also transitioning to an undocumented, unprotected status. And so my work has looked at the experiences around mental health of them resettling into new communities. So I looked at how is it for them to resettle into new communities. This was a statewide California study. And what is their experience accessing social services as transitional age youth? All of them, all 20 of the youth that I interviewed, so there were 20 unaccompanied youth that I interviewed, 20 child welfare workers who I interviewed across the state of California, and the rest were made up of social service providers across legal services, health fields, mental health, school-based, and so on. The findings mainly showed 5 things. One is that their mental health experiences, of course, were extremely challenged. They experienced a ton of anxiety, navigating new communities, feeling a bit lost in the world, and navigating not only an ambivalent context of reception, but oftentimes a volatile or hostile context of reception. With that being said, another important finding was their economic insecurity that they experienced, many of them migrating here to find work, and that being very difficult once they arrived, resettling into employment experiences, which oftentimes meant labor exploitation and instances in which they were trafficked. Another important finding was their academic experience, oftentimes having to choose between work and school. While they wanted to attend school, it was oftentimes very difficult because their basic needs of supporting themselves and their families back home was really important. We also looked at resilience and how they navigated things. And so experiencing a sense of belonging for many of them, especially those who were integrated into newcomer schools, was actually a protective factor. Experiencing aspects of mutual aid, supporting each other, other newcomers was really important. And this was a population who entered without inspection. So they did not go through the formalized channels of being detained at the border and having some kind of post-relief support. So that's been where a lot of my work has been centered. The most recent work that I've been doing, it's a very new study supported through the Walter S. Johnson Foundation. And what we've been looking at is, or what we're intending to look at, essentially, it's a 2-year study that's concentrated within the state of California, is how are public child welfare workers throughout the state of California meeting this moment in terms of understanding the needs of immigrant families who are currently experiencing deportations, detentions for parents, and for many of them, children who are entering the system for the first time. So we are conducting a needs assessment, a survey of public child welfare workers. We're hoping to obtain about 225 public child welfare workers' experiences through a needs assessment to understand what are their needs at this moment. As I mentioned earlier, many public child welfare agencies have not yet sort of been trained or have the capacity in some regards to serve the needs of immigrant families. The system wasn't designed for that. And so many agencies at this moment are navigating new territory. So we're hoping to find out what are the needs of these public child welfare workers. And also we're hoping to interview them as well, along with families who have lived experience in the public child welfare system, and legal service providers. So we're hoping to get a really holistic picture of what the needs are at this moment, how child welfare workers in many cases are providing support, what they're doing in terms of best practices, what their needs are. From that information, we're hoping to provide trainings to different agencies in the child welfare system who may need support. We're looking at rural and urban counties again throughout California. And once we have conducted the trainings, we're hoping to again do another survey to see how successful the experiences were and provide some tangible kind of reports and information to disseminate to child welfare workers so that they have resources and tangible information on hand in case, for example, they experience a family member or families who are going through detention, deportation. They have tangible resources on hand. So this will be a 2-year study, and we're just experiencing the IRB process now, so it's underway. But in terms of your question around gaps, I think the most important thing is that as immigration enforcement has ramped up, as forced migration has, had really difficult negative outcomes for families, I think it's important to look at the long-term longitudinal impact. Um, Not that these issues are new, but these issues do need to be studied in a longitudinal way with multi-dimensional approaches from qualitative to quantitative methodologies to looking at and gaining lived experiences from those who have been participating and experienced these challenges, utilizing allied and interdisciplinary professionals to also weigh in from legal service providers, school-based mental health fields, and so on. We really need a full picture of what has been going on in a longitudinal way, and of course, centering the voices of those who have experienced it, the lived experience.
Thank you so much for that. It's like your work is also leading the way for future researchers, and what you've done and you've been doing so far really has, I think, such important implications for the communities and for practitioners as well. So, a question related with that. So, what advice would you offer to students or early career scholars interested in this field?
Yes, that's an exciting question. I think for master's level and doctoral level students, I think it's really exciting and important to have both theoretical grounding and practice level knowledge. And so for those who have master's level experience, it's amazing to be able to go out into the community, to have at least 2 years, if possible, experience working with populations on the ground, to really understand and humble oneself, to understand what is the experience like, what are some of the supports that are working, what are some of the best practices, what are also the barriers and the systemic inequities. I think having a multi-level perspective on the work, so meaning being able to look at forced migration from a multi-level perspective, looking at the micro level, meso level, and macro level, understanding and experiences of what families are going through is really important. I think I always advise students to go out into the community and do community engaged work in which you avail yourself to the community, in which you understand from the community's experience what research questions or what needs they have, not just what we want to know. Yeah. So making ourselves available to the community as a resource, not just dropping in and taking information, but rather making yourself available. As social work practitioners, we have a huge toolkit, and we can also make ourselves available in many ways to communities that is generative, that's fruitful, that is supportive. One of the advice that I received from one of my doctoral advisors, Dr. Carola Suarez Orozco, was to actually utilize my skill set as a social worker during my doctoral studies. I volunteered at the school in which I was collecting data for 6 months prior to collecting data, so that I was a familiar face. I was someone who was trusted. I was someone who was vetted, and the school itself felt a sense of trust and understanding of who I was, and that I wasn't someone who was exploiting them for data. And I was able to provide social emotional support through my social work skills by offering a newcomer support group at the school that I was collecting data in. And so I wore 2 different hats. I put on my social work hat 6 months prior to collecting data. Again, I got to know the community. They got to know me and feel a sense of trust. Once that time period ended, I was able to then enter a new area of being a researcher and one who is community engaged. And I would recommend that if doctoral level students have a chance to actually volunteer at sites before or spend time there doing engaged work, getting to know the community, and again, building that trust. I think it goes a long way in terms of being able to understand what's really at the heart of what the community wants, and for the community to feel a sense of trust and capacity to also go deeper with you and And ultimately, the research is going to be at a higher level at that point because you are a trusted entity. And I think um, possessing those kinds of social work values and skills of being kind of centered in social justice, being committed to communities is so critical and important for our future researchers to embody.
Thank you so much for that. It's so inspiring to like hear your recommendations and guidance, and I understand that the importance of centering communities and also the importance of trust in this line
Yes,
of work.
agreed.
So my last question is there a book related to forced migration? It could be a biography, novel, or a textbook that you would recommend.
Yes, actually, I have three. The first one is a seminal text by Dr. Carola Suarez Orozco. It's called Children of Immigrants, and it came out in the early 2000s. It's a seminal work. I actually discovered it when I was a bilingual practitioner. I saw it on the bookshelf of our agency, and it had such an impact on me that it really informed my decision to pursue doctoral studies because it gave me the language to understand what children of immigrants are going through in terms of navigating identity, navigating transitions in the community, navigating um, some of the experiences around forced family separations. And for the first time as a social work practitioner, I was understanding theory to which I was experiencing as a practitioner. So it was like theory and practice together. And that actually did set a template for me to want to study the work that I have been doing over the last 20 years because of that seminal book. And I went on to become a mentee of Dr. Suarez Orozco, which was an amazing experience, all because I picked up this book. The second book that I'd like to recommend is Sin Padres ni Papeles, and that book is by the scholar Dr. Stephanie Canizales, who is at UC Berkeley in the sociology department, and it's an ethnographic account of unaccompanied minors who were based in LA. She did really amazing ethnographic research to understand the experiences of unaccompanied minors who not only were migrating to the US, but were also navigating the complexities of transitioning to adulthood while also um, experiencing the labor challenges of needing to work and needing to experience economic security. So that's a profound ethnographic account of unaccompanied minors' experiences. The third book that I'll recommend is called Precarious Protections: Unaccompanied Minors Seeking Asylum. This book is by Dr. Chiara Galli, who is at the University of Chicago. Again, another sociologist scholar who is writing about some of the legal aspects of what unaccompanied minors experience once they arrive in the US. Some of the difficulties navigating the legal system, the asylum process, and some of the actors involved, social workers, legal providers, who both provide access and support, and also the difficult systemic inequities that they experience along the way. So I would recommend that book as well.
Thank you so much for all of your work and also being here and sharing your work and your experiences like with our members. We really appreciate your time and also your work. Thank you so much.
Thank you. Well, thank you for the opportunity to be here and for the work that you all are doing. It's tremendous to see the kind of wide, uh, the dissemination of your work, the wide aspect in terms of the populations that you are trying to better understand, the systemic inequities, and the aspect of economic insecurities that you're looking at pervasive throughout forced migration. So thank you for the tremendous work that you all are doing and leading.
Thank you. Thank you so much.
My pleasure.
Thank you.